Hello, my name is Leonor. I'm head nurse here in Buchinger Wilhelmi Marbella. I work here for 34 years. I'm work as a head nurse, but I work with patients every day. And I would like to tell you today what are the most frequently asked questions of our patients. So one of the questions I hear the most is, why don't I lose more if I'm fasting? The weight loss depends on many factors. So it depends on the overweight we have, the basal metabolism, age, gender, medication, some diseases. And so everybody is not losing the same. Buchinger Wilhelmi fasting provides 250 kilocalories, more or less, a day. And we used to eat more or less 2,000 calories a day. So it makes a difference of 1,800 calories. That makes more or less 200 or 300 grams fat. So it's impossible to lose much more. People who are losing more are people who probably used to eat 3,000, 4,000 kilocalories a day. But if we don't eat such a big amount, we cannot expect to lose more. I always say that the first days of fasting are the honeymoon, the 2 first days, because we can lose 1 kilo a day, the first and the second day. Why? First of all, because the preparation day, fruit day or rice day, is very diuretic, and that we arrive usually tired, we used to drink alcohol, our food is more salty, so we usually have some water retention. But once we lose all this liquid we had, we will lose 200, 300 grams a day. That's what we can expect. And I always say that one packet of butter is 250 grams, and it's a big amount. So to lose this amount every day is not a bad thing. So why do I have to do an enema? This is one of the most frequently asked questions of our patient. So the intestine and the microbiota is a fundamental organ for our immune system. Our way of life, our fast food, the excess of animal proteins, of refined sugar, nicotine, alcohol, stress, have a very bad effect on our intestine. His membrane becomes permeable, and some symptom and disease as colitis, gas, constipation, allergies, and intolerance appears. Now we know that fasting boosts intestinal stem cells' regenerative capacity. So the enemas clean and rid the intestine of pathogenic bacteria and toxins. That's why it is so important to do this enemas every 2 days. So usually we use just pure water to do the enemas, but we use some green coffee when people have headaches. So we know that it helps a lot, and we are using it with very good results. So one of the questions that our patient asks frequently is, why do I have to do the food reintroduction here in the clinic? Because I would like to go on fasting, or I would like to do it at home. So I always say that fasting is a period of elimination and deconstruction. When we finish fasting, we have to rebuild, and food is the brick that will serve to rebuild our cells. So the quality of our food will be essential. That's why the results for our health and wellness will depend on it. We are what we eat. Here, when people go on with the food reintroduction, everything is really balanced. So it is very important that for the first week, even the 10 first day, our patient don't eat refined sugar, animal protein, alcohol. So this reintroduction here is very important for the success of the future of the fasting. So, and it would help our patient to reach their goal, their health or weight loss. So some patients do not understand when they arrive why they have to see the nurse every morning. So I always explain them that we are big observer, we are guide, we walk with them through the fasting. Every morning we see our patient, we check their weight, their blood pressure, temperature, heart rate. We ask them how they slept, how they feel. We review with them their planning. We remember then if they have a doctor appointment. We organize with them the timing for enemas, for liver pack. So it's a very important moment for us and we build a relationship. So I think our patient, when they arrive for the first time, they do not understand. But after 2-3 days, they don't miss the nurse appointment in the morning, because it's really a very important and nice time we have. And I think this time makes them feel safe and make them understand what happened with their body. Sometimes they are afraid because they feel a little bit dizzy in the morning, perhaps so. And we are big observers, so we will see if there is any symptom that needs our patient to be referred to the doctor. So it's a very important moment. And I think in Bochinger, Wilhelmi, Marbella, so this timing we have with the patient, with the nurse in the morning, is really an important moment for our patients. So another question that our patient ask frequently is, why do I have a bad breath? So when we are fasting, after 2 days or 3 days, we have used all our glycogen stocks, so our glucose, and our body is forced to use fat to have energy. So this fat will be transformed in ketone bodies, which are eliminated by urination and exhalation. That's why we have this embarrassing smell. So, but it doesn't have to worry our patient. It's something natural, and it means we are burning fat. If you found our video interesting, please follow our channel and give us a like. I hope to see you soon. Goodbye.